The time has been changed to 9 o'clock.
Type 831 851 3051. So 301.
Two cases or one case?
Sir?
One case or two cases?
It's on a general examination, sir. No case.
Oh, acha, only acha. How to do general examination?
Yeah, that's it.
Yeah. I saw that. Yeah.
Sir, we have reached the 100 limit.
Okay.
And now I have started streaming on the YouTube, so we can start now.
Okay.
Good evening, everybody. A warm welcome to the PG Clinic conducted by IAP Cochin branch. And I am very thankful to Dr. Riyaz sir for taking up this general physical examination class in pediatrics. And now I invite Dr. Shiji Jacob, who is the coordinator for the IAP PG Clinic. Over to you, madam.
Yeah. Good morning, sir. Good evening, sir. Yeah. Good evening, sir. Good evening, everyone. It's my proud privilege to introduce to you Dr. Riyaz, sir. I think sir does not need any introduction because he is globally famous, and we are really proud of you, sir. And sir was the professor and head of the department, Calicut Medical College, and now presently sir is the professor and head of the pediatric gastroenterology department, KMCT Medical College. And as you all know, sir is the recipient of many prestigious awards. He has published so many papers, and he has got number of publications to his credit. Sir has authored many books, and sir is a great academician, and we are so fortunate, sir, to hear you this evening time. And sir is a great academician. He's a wonderful teacher, and I really invite you, sir, expecting a brainstorming session from you, sir. So it's our privilege to hear you this evening time, sir. Welcome, sir, and over to you, sir.
Hello, good evening, everybody. Kelkadanda, Shiji. Can you hear me? Okay. Good evening, everybody. Yeah. Thank you so much, Shiji, for the nice words.
Dr. Riyaz, a great academician with general knowledge. with all past history, film actors, actors, films.
Okay. Thank you, sir. So I would like to thank Professor Shiji Jacob, Dr. Pramod Warrior, and Dr. Sajid John of IAP Cochin for giving me the privilege to be a part of this fascinating PG teaching program. I'm really happy and honored that my guru and mentor, Srinivasan sir, has also joined us. Now, pediatrics, as you know, is a...
He always cracks jokes. This is one of his jokes.
No, sir. Really from my heart, sir. And pediatrics is an exciting specialty, I believe, mainly because we can diagnose a large number of conditions just by taking a look at the patient. And hence, general examination is very important in pediatrics. Now, this is going to be an interactive session. We'll be discussing some of the commonly or frequently asked questions in PG examinations, DCH, MD, or DNB. You can write the answers in a chat in the chat box, and these answers may be read by Dr. Shiji. And Shiji, you can stop me at any time if the time is over. Absolutely no problem. Okay.
Yes, sir.
We'll start with a quiz. Now, who is this? Well, this is none other than Hippocrates, the father of medicine. So Hippocrates is the father of medicine. Now this is Sir William Osler, who is regarded as the father of modern medicine. Okay, so William Osler had made bedside teaching in a beautiful art. So we are really indebted to Sir William Osler, who is the father of medicine. Now, general examination should commence as soon as the child enters the room. Okay, so it continues throughout history taking. So taking history, you can watch the child, and it is said to be successful only if I examine everything you want, and you will be considered as a good pediatrician only if you can accomplish this, only if you can do this without making the child cry. Now, this is going to be very difficult. You should not make the child cry. Now, question 4: name the only branch of medicine apart from pediatrics that gets history from bystanders and not patients. You can write in the chat box. The only branch of medicine apart from pediatrics that gets history from the bystanders and not from patients. Shiji, ആരെങ്കിലും എഴുതിയിട്ടുണ്ടോ? Anybody has written? The only branch of medicine apart from pediatrics that gets history from bystanders and not patients.
Geriatrics എഴുതിയിട്ടുണ്ട്, sir. Neonatology. Somebody has written veterinary.
Okay, and most students, including postgraduates, usually give the answer as psychiatry. Most of them usually, you are very good, okay, psychiatry. But remember that psychiatric patients will be given us beautiful history. You remember this scene? This is a hilarious scene from the film Ulladakam. Remember, Jagadi was acting as a psychiatric patient, and his complaint was that there was a horse in his tummy. There is a horse in his tummy which is creating all his problems. So psychiatric patients will be giving beautiful histories which may not be correct. So the clue is that, as somebody rightly mentioned, it is veterinary medicine.
Veterinary. They have written veterinary, sir. Many have written veterinary.
Very good, very good. Unless you are Dr. Doolittle. Now, who is Dr. Doolittle? Dr. Doolittle was, that's actually a very famous movie which was released in 1998. Dr. Doolittle could speak with animals. Okay. Now, who acted as Dr. Doolittle in this famous film? It was Eddie Murphy. So it was Eddie Murphy who acted as a Dr. Doolittle in this famous movie. Now back to pediatrics. What is Murphy's law in pediatrics? What is Murphy's law in pediatrics? Murphy's law means the child whom the pediatrician or the resident most wants to examine thoroughly will be the one whom it will be the most difficult to examine fully. Okay. Suppose for example, in your examination, you want to examine the patient thoroughly. But unfortunately, this is going to be the most difficult to examine fully. So this will be very disastrous, especially in the examination. So that is Murphy's law in pediatrics. Now, how many people can you see here? It appears there are only 2 people. But if you carefully observe, you can see that there are actually 3 people: an old man, an old lady, as well as a young lady. So only experts would see all. And hence, pediatricians and residents in pediatrics should be like Sherlock Holmes. You should be inquisitive like Sherlock Holmes. Now, unfortunately, nowadays the young generation has got a contempt for the old people, old concepts and old people. Can you spot these people? I really feel dismayed when nobody is able to identify these brilliant people. Who are the gentlemen? Who is this? This is actually Mohammed Rafi. And who is this? This is Kishore Kumar. Okay, old people. So that's why we said old is gold. And this is Madhubala. The beautiful ladies are Madhubala and Tanuja. So why do you say old is gold? Because if you go through the old Hutchison, that is much better than the latest Hutchison. The latest Hutchison, even though it's mentioned as clinical method, it's full of investigations. So I would always recommend you to read the old Hutchison, which contains mainly the clinical methods. That's the reason why we say old is gold. Now, what are the relatively benign findings in neonates? What are the relatively benign findings in neonates? A lot of benign findings: acrocyanosis, periodic breathing, preterm babies. And what is this? That is Epstein's pulse. Okay, Epstein's pulse, vitreous milk, vitreous bleeding, Mongolian blue spot. These are some of the other benign conditions in newborn babies. And what is this? This is the so-called stork bite marks or capillary hemangiomas, which may be seen in the forehead as well as the nape of the neck. Then cephalhematomas, caput succedaneum. Sometimes there can be some amount of subconjunctival hemorrhage. Craniotape. These are some of the other normal benign findings in neonates, apart from innocent mammals. Now, what is the relevance of blueberries in neonatology? What is the relevance of blueberries in neonatology? This is a blueberry muffin baby. Head of blueberry muffin baby. So what is a blueberry? What is a muffin? Muffin is actually a bread or cake. It is soft and moist, and it is loaded with blueberries. So you can see a cupcake containing blueberries. And these babies have got a resemblance to this muffin bread. You can see multiple purple marks or nodules on the skin of the baby. So what are the conditions where you get the blueberry muffin? The mechanism is it's actually an extramedullary erythropoiesis, so the dermal erythropoiesis, seen in various torch infections, especially cytomegalovirus infection and rubella. And remember that very serious conditions like tumors, leukemia cutis, neuroblastoma, and Langerhans cell histiocytosis, these conditions can also present as blueberry muffin babies. The relatively benign findings in older children are semen crease, telangiectasia, a few capilla macules, a few lymph nodes, sinus arrhythmia. Remember that sinus arrhythmia may be normal in children, genu wear may be normal, and bruxism or teeth grinding. These are some of the other somnambulism, CLS, and breath holding spells. All these are relative benign conditions in older children. Now, what are fontanels? These are gaps in the skull where three bones meet. How many fontanels are there at birth? How many fontanels are there at birth? Anybody?
Some have mentioned six.
Correct. There are 6 fontanels at birth. We have the anterior fontanel. What is the shape of the anterior fontanel? You can see that the shape of the anterior fontanel is a diamond shape. Anterior fontanel is diamond shape, whereas the posterior fontanel is triangular shaped. So in addition to the anterior and posterior fontanels, there are 2 anterolateral and 2 posterolateral fontanels. These are the 2 anterolateral fontanels. They're also known as sphenoid fontanels, and 2 posterolateral fontanels are the mastoid fontanels. What about the closure of fontanels? The anterior fontanel closes between 9 to 18 months. It's actually a range, wide range of 9 to 18 months. Whereas when do the posterior fontanels and lateral fontanels close? They close almost together by 6 to 8 weeks. Close by 6 to 8 weeks. I'm sure you are aware of the various conditions that cause delayed closure of the anterior fontanel. What are the causes of early closure of the anterior fontanel or posterior fontanel? Remember that one of the most common causes of early closure is a normal variant, or the patient may be developing microcephaly or craniostenosis. Craniostenosis can be diagnosed by palpating for ridging at the suture lines. There are 3 endocrine conditions which can cause early closure. What are they? 3 endocrine conditions which may cause early closure are hyperthyroidism, hyperparathyroidism, and hyperphacetism. So 3 endocrine conditions may result in early closure. Now, what is third fontanel? Heard of third fontanel? What is third fontanel? Well, third fontanel is actually a widening of the sagittal suture in between the anterior fontanel and the posterior fontanel. It's also known as the sagittal fontanel or the parietal fontanel. So this may be seen in normal also. And about 6% of normal babies can have a third fontanel. But what are the conditions of the third fontanel may be seen? It is more common in children with Down syndrome and in children with congenital rubella syndrome. So these are 2 conditions in which the third fontanel or the sagittal fontanel is more common. Now, who described congenital rubella syndrome? Can somebody mention who described congenital rubella syndrome? Congenital rubella syndrome was described by an Australian ophthalmologist called Norman Gregg. Norman Gregg. So it's known as Gregg syndrome. So congenital rubella syndrome is also known as Gregg syndrome. Now, how will you find out whether the child has got a brachycephaly or dolichocephaly? This is by measuring the cephalic index. You should be knowing how to calculate the cephalic index. The maximum breadth of the skull divided by the maximum length multiplied by 100. So if the cephalic index is less than 76, that is dolichocephaly. If it is more than 80, that is brachycephaly. So in the examination, when you're presenting case for the MD, DNB, or DSH, you should not just say the child has got dolichocephaly or brachycephaly. You have to substantiate your answer by calculating the cephalic index. It's very simple. It takes only a few seconds. Now, what percent of children with this syndrome have got congenital heart disease? Anybody? What percent of the children with this syndrome have got congenital heart disease? Shiji answer. Somebody answered.
Nobody, sir.
See, when I show this as a quiz for undergraduates, the young boys, they tend to be carried away by the nice looking ladies. Therefore, they look at the lady and not the baby. So please look at the baby only. The baby has got what the diagnosis?
50% maybe.
That is Down syndrome. That is Down syndrome. So 50%, correct. So once I asked a question to the postgraduate in the examination, what percent of the children with Down syndrome have got congenital heart disease? The candidate stared at me for some time and he said, sir, 5 to 95%. So you can choose 5 to 95%. So his nickname was for a long time 5 to 95%. So the correct answer is 50%. 50% will be having congenital heart disease and 50% will also be having in Down syndrome, that is semi-increase. So semi-increase and congenital heart disease in Down syndrome to the tune of 50%. Now this is an old patient of mine. He died long back. Of course, he's got Down syndrome. What are the other findings in this child? He was actually from Perinalmanna. What general examination? What are the findings apart from Down syndrome? Well, you can see that he's got a scar here. Can you see that scar? What may be the reason for this scar? The lower abdomen. That's because he was constipated and he was operated for Hirschsprung disease. One of the common congenital gastrointestinal anomalies of Down syndrome is Hirschsprung disease. So he was actually operated for Hirschsprung disease. But he was referred for evaluation of hepatosplenomegaly and petechial purpura. What may be the reason for petechial purpura and hepatosplenomegaly? Remember that one of the important cause of death in children with Down syndrome is various types of leukemia. So this child had actually M7 leukemia. What is M7 leukemia? FAB M7 leukemia is acute megakardioblastic leukemia. There's another child with Down syndrome, but you can see that he's got central cyanosis and clapping. So this older child with Down syndrome had tetralogy of Fallot. This is one of my oldest patients. You can see that this photograph was taken in 1990 when his name was Nausha. He was only 6 years. I had seen him when he was just 3 months old in a place called Karandur, where I started my practice in Calicut. So at 6 years, you can see that he has developed. What is the finding? You can see that he has developed alopecia area. Can you see the alopecia? Alopecia areata. By 10 years, you can see that the alopecia has become alopecia areata, that has become alopecia tortoides. 14 years, he started regrowing some hair. So that is white hair. 18 years, see, is more hair. At 20, you can see that his photograph is a 12-year-old cousin. You can see that he's wearing a cricket cap because even though he's got Down syndrome, he's worried about his handicap, that is he wants to Mask is the alopecia by wearing a cricket cap. At 22 years, came with a dental abscess. Can you see his mother? And this was when I saw Naushad last. I saw him in 2008 when he was 24 years old. Naushad used to come to our pediatrics OP of Calicut Medical College, even when he was 24. He would take an OP ticket, say Naushad 12 years. He was just like a Bob and Molly. Bob and Molly is Bob and Molly. You remember Bob and Molly comics? Bob and Molly in 12 years. So similarly, Naushad was always Naushad 12 years. I really do not know what has happened in Naushad. No, because I saw him last almost 12 years back. So this is old photograph at 6 years. So he has really seen the life cycle of a child with Down syndrome right from 6 years to 24 years. So what are the congenital heart disease seen in Down syndrome? What is the most common congenital heart disease seen in Down syndrome? Shiji, anybody in the chat box? What is the most common congenital heart disease seen in Down syndrome?
Endocardial Cushing, sir, chat box.
Actually, your answer should be complete atrioventricular septal defect. The atrioventricular septal defect is not a complete answer. Complete atrioventricular septal defect. Almost 30. Okay. That's right. Okay. That is 38%, followed by VSD 30%, ASD 15%, partial AB septal defect. That is 6%. That's the reason why I said you should not just PG should not just say atrioventricular septal defect. You should say complete atrioventricular septal defect, which is the most common anomaly. Then TOF, tetralogy may be seen in 5%, PD in 4%, and miscellaneous 2%. So these are some of the common congenital heart disease seen in Down syndrome. Now, what is this? What are the findings? We can see that and the clue for that is, who is this? This is Salman Khan. What has Salman Khan got to do with this syndrome? You can see that he's got macrocephaly. He looks retarded. Yeah, that's right. So he's got cyanophrys, okay, delayed dentition, depressed nasal bridge. So this is mucopolysaccharidosis. So Salman Khan, you know that Salman Khan was arrested, had been arrested several times. 25 years back, he was arrested for, then students may say poaching. There's no poacher's disease, shooting, no shooter's disease. For hunting, okay, so this is hunter's disease. This is hunter's disease. So this was actually hunter's disease. So what are the mucopolysaccharidosis with normal vision? Many of the mucopolysaccharidosis got defective vision because of corneal clouding. Suppose there are two conditions with normal vision. Number one is Hunter's disease. What is the clue for that? The clue for this is that for hunting, vision should be good. So in Hunter's syndrome, vision is not affected. The second condition is type 3 or Sanfilippo syndrome. So in Hunter's syndrome and Sanfilippo syndrome, usually the vision is not affected. Now, what are the causes of long eyelashes? Long eyelashes, that's actually a sign of beauty, supposed to be a sign of beauty. It may be a sign of protein energy malnutrition. Children with the severe PM tend to have a long curly eyelashes. And this syndrome. What is this syndrome? One of the classic syndromes in pediatrics, that is Cornelia de Lange syndrome. With you can see the sign of face, down turning upper lip, long eyelashes, long philtrum. So that is Cornelia de Lange syndrome. Now, what is this and what is the relevance to syndromes? What is this? Anybody? Should be adding a this is a lobster.
Lobster in the chat box. Lobster.
Correct. So this is where do you get lobster claw deformity? Lobster claw deformity is seen in de Lange syndrome. So lobster claw may be seen in again Cornelia de Lange syndrome. What is de Lange sign? De Lange sign is actually fissuring in spatiocerebral palsy. Fissuring in spatiocerebral palsy. This sign was actually taught to me by Professor Anandam. Anandam madam, when I was doing DCH in Trivandrum Medical College in 1981 to 1983. Professor Anandam is one of the best pediatric neurologists, one of the first pediatric neurologists of India. She was an excellent pediatric neurologist, and it was she who taught me about the de Lange sign, and I never forgotten de Lange sign, that is fissuring in spatiocerebral palsy. This is a hilarious scene in a movie which helps you to diagnose a syndrome. Anybody? Apart from my own students will be knowing that.
Poland syndrome chat box. Poland.
Are
Kavya Menon.
Kavya
Rakesh.
Menon is my own student. Okay, Kavya and Rakesh are my students. So, anyhow, this is Sandesham. You have seen this? See? So, Sandesham is one of the most hilarious scenes. Srinivasan പറഞ്ഞത് pollen പറ്റി ഒരു അക്ഷരം മിണ്ടരുതെന്ന് പറഞ്ഞിരിക്കുന്നത്. So this is pollen syndrome. You can see the syndactyly, the hand deformity plus absence of pectoralis muscle. So that is pollen syndrome. This child was delivered in Calicut Medical almost 20 years back. He had a large VSD and he died a few days later. This is the hand of the child. What are the findings in the hand? And what is the most probable diagnosis? You can see that there is overlapping with the second, third, and fourth fingers. There is a simian crease and there is a polydactyly. These plus a large VSD will make you Edwards syndrome. This is correct. Edwards syndrome or trisomy 18. These are the congenital heart disease seen in Edwards syndrome. Now, what type of polydactyly is this? How do you classify polydactyly? There are essentially two types of polydactyly, post-axial and pre-axial. What type of polydactyly is this? Anybody chat box? You can see that the extra finger is on the ulnar side. So it's called
Post in the chat box.
Post-axial polydactyly. Okay. When it is on the radial side, it's called pre-axial polydactyly. So we have post-axial polydactyly versus pre-axial polydactyly. Or it could be type A polydactyly, means the whole finger including nail. That is type A polydactyly. If there is only vestige of a finger, that's called type B polydactyly. This is a question now, which is the Bollywood celebrity with polydactyly is Hrithik Roshan. What type of polydactyly does he have? Is it pre-axial or post-axial? Is it pre-axial polydactyly or post-axial polydactyly? Chat box, anybody in the chat box?
Chat box pre.
Yes. You can say that when he's dancing, you can see, sometimes you can see it's actually pre-axial type A polysyndactyly. Can you see that? It's actually a pre-axial type A polysyndactyly. That is Hrithik Roshan's problem. Now, this child was also delivered in Calicut Medical College almost 20 years back. He also had both these children had large VSDs, and both of them died a few days after birth. They got midline facial defects. What's the most probable diagnosis? These features, which chromosome anomaly is it likely to be? Midline facial defects, large congenital, large VSD, and dying in the early neonatal period. That is Patau syndrome. That's right. Correct. Trisomy 13 or trisomy D or the Patau syndrome. Now, which trisomy has the highest incidence of congenital heart disease? You know, there are three important trisomies. There are several trisomies. The most important are three. Which trisomy has the highest incidence of congenital heart disease? Anybody?
Trisomy 18 in the chat box, Lisa.
That's 18 or Edwards syndrome. 90% of Edwards syndrome have got congenital heart disease, followed by Patau syndrome, that is 80%, and Down syndrome is only 50%. What about Turner syndrome? Turner syndrome is only about 25 to 30%. It's only about 25 to 30%. So this child was referred to us for dysmorphism. There are very striking facies. Can you see that? These are actually large bilateral inguinal hernias. And he had mitral regurgitation, tricuspid regurgitation, mitral valve prolapse, and tricuspid valve prolapse. And it's got a peculiar facies. And the clue for his facies is this. What is this dog called? This is actually
bloodhound.
This is a bloodhound facies. Bloodhound facies. Okay. So what the diagnosis? The diagnosis is obviously bloodhound facies seen in cutis laxa. So this child has got cutis laxa. Name the syndrome with a heart-shaped face. What is the syndrome which has got a heart-shaped face? So look at the face. That is Turner syndrome. So Turner syndrome has got a heart-shaped face. So this is Henry Turner, who described the Turner syndrome, the famous American endocrinologist. These children have got the features suggestive of a Turner syndrome. Do you think that is Turner syndrome? Unlikely, because one is a girl, the other one is a boy. So what is the differential diagnosis of Turner syndrome? That is Noonan syndrome. These children had an ejection systole in the pulmonary area. Okay. What the most common cardiac lesion of Turner syndrome? That is coarctation of aorta. Usually get right, that is coarctation of aorta. But this child had pulmonary stenosis. These children had pulmonary stenosis. So this is Noonan syndrome. But otherwise, you can see the webbing is there, pectus excavatum, bilateral ptosis. All these are similar to Turner syndrome. And this is erroneously called as male Turner syndrome. Remember that Noonan syndrome should not be called male Turner syndrome. They're entirely different, because Turner syndrome is a chromosomal anomaly and this is an autosomal dominant condition. So it should not be called male Turner syndrome. Now, what is common to these children? One is a 1-year-old child, and the older child is a 12-year-old girl. What is common to them? What is common to them? You can see that both look very pale, depressed nasal bridge. The older child is having mild jaundice. Okay. For the diagnosis, what is the diagnosis? So what is the diagnosis? Anybody in the chat box, Shiji?
No one. Hemolytic facies, chat box.
So the classic hemolytic facies. What is the other name of hemolytic facies? It's also known as the chipmunk facies or the rodent facies. Chipmunk facies or the rodent facies. Now, who described thalassemia first? Remember that thalassemia is also known as Cooley's anemia. So that is Thomas Cooley. Thomas Cooley along with another person. I will give a clue for that. The Cooley and who is this? This is actually Bruce Lee. He didn't describe it, but Dr. Lee. So Cooley, Thomas Cooley and Dr. Lee in 1924. These are the first persons to describe thalassemia. Was the first Indian to describe thalassemia? The clue is this: her cousin. Who is this? Who is this? Her cousin. Her cousin is Rani Mukherjee. Of course, Rani Mukherjee didn't describe it, but Dr. Mukherjee from Bengal was the first Indian to describe thalassemia. Mukherjee from Bengal in 1935. Now, these children are actually from 5 different families, but they look strikingly similar. All of them have got a strikingly similar facies. They are presented with the abdomen distension, especially upper abdomen distension, hypoglycemia. What's the diagnosis?
Chat box GSD, sir.
That's right. This is huge. That's right. Huge hepatomegaly. What is the facies called? This is called the doll facies. It's a doll facies, huge hepatomegaly. Most probably type 1 or type 3 glycogen disease. Doll facies of GSD. So the same child at 15 years. And what is this finding? This is actually xanthoma, linear xanthoma in a child with the GSD. You can see the lipemic serum of the same patient. Now, this is a striking class is Spartan periodis. What the finding and what the diagnosis? Anybody in the chat box, Shiji? Apart from KMCT students.
Wardenberg പറയുന്നുണ്ട് sir. Chat box many have white forelock.
That's right. White forelock. Can say there is a partial heterochromia also. Okay, you can see the sign of risk. So this is Wardenberg syndrome. Is an autosomal dominant disease. The heterochromia is actually partial. There is a partial heterochromia of the left iris. He has deafness, sign of risk. The same child at 5 years, at 8 years, and at 20 years. It's actually a Hauser's PP. So he came to me a few years back. He's an auto rickshaw driver now. Do you think that's a safe job for a Wardenberg syndrome? Definitely not. Why? Because he's deaf. He has got deafness. So a deaf person should not be an auto rickshaw driver. Anyhow, he's an auto rickshaw driver even now. Now let's see some basic skin lesions. Which is the largest organ in the body? The largest organ in the body. Which is the largest organ in the body?
Skin, chat box.
What is the weight of the skin? That depends upon your profession. If you're a politician, it may be thicker. Anyhow, the average weight of skin of an adult is 4 kg. Right? Which is the second largest organ? It is obviously the liver with 1.5 kg. So these are the basic skin lesions. A circumscribed flat lesion which is less than 5 millimeters is called a macule. A similar lesion which is more than 5 millimeters is called a patch. Now look at this patient. What are the lesions you are seeing? Here you see 2 macules less than 5 millimeters. And this is, can you see this patch here? Can you see this patch?
Sir, visible.
So this is this is a patch. There are 2 macules. What is the diagnosis? This has to be type 1 neurofibromatosis. This child with type 1 neurofibromatosis. Don't just say neurofibromatosis because you don't get cephalomacules in type 2 neurofibromatosis. Now, here you can see elevated palpable lesions less than 5 millimeters in diameter. That's called a papule. Can you see that?
I wanted to make a remark, sir. Can I make?
Yeah, sure. Please do, sir.
Husband and wife, that's why they took up the largest organ, skin and the liver.
Okay, sir. Thank you. So we have papule, which is less than 5 millimeters in diameter. And here you can see a plaque, which is more than 5 millimeters in diameter. What's the diagnosis here? What's the papule called? What's wrong with this child? What's the diagnosis? Anybody other than KMCP?
Tuberous sclerosis.
So obviously that is tuberous sclerosis. Actually, this is an angiofibroma. This is erroneously called adenoma sebaceum. This should not be called adenoma sebaceum because that's a misnomer. Adenoma sebaceum means a tumor of the sebaceous gland. This is not a tumor of the sebaceous gland. It's a vascular malformation. So this should ideally be called angiofibroma. So we have fluid-filled lesions which are less than 5 millimeters. That's called a vesicle. Classic example is chickenpox. Larger lesions are called bullae. Bullous embytic is a typical example of bullous lesions in children. Now, spontaneous bleeding occurring in the skin is of 3 types, which is smallest lesion. Smallest one is petechiae, pinhead or 1 to 2 millimeter in diameter. 2 to 5 millimeter diameter is called purpura, whereas more than 5 millimeter diameter, that's called ecchymosis. So here you can see all lesions. You can see petechiae, you can see purpura as well as ecchymosis. What is this sign called? Anybody? What is this sign?
Flag sign, sir.
That's a flag sign. What's the other name of flag sign? So one more name for flag. The flag sign is also known as sign de la bandera. The flag sign is also known as sign de la bandera. So you get alternate bands of dark and light hair due to intermittent bouts of good nutrition, poor nutrition. You admit the patient, give them good nutrition, so they'll develop black hair. And when they go back to the original surroundings, they'll develop malnutrition again and hence white hair or a pale hair. That is flag sign or a sign de la bandera of Kwashiorkor. Oh, this is another classic photo. You examine the hair and the ear of a children. Sometimes you may say a bumpy lesion like this. What is it called? The clue is this. Now, who is this? Who is this? This is Charles Darwin. And this is known as Darwin's tubercle. Darwin's tubercle may be seen in normal children, but remember that it is more commonly seen in children with Down syndrome also. Okay, normal children as well as in children with Down syndrome. Well, this is an old patient of mine now. So it's actually referred in 2000, almost 16 years back. It was referred for evaluation of ecchymosis. Can you see the ecchymosis here? So he had easy bruisability. So it's referred as some bleeding disorder. But his hematological workup was essentially normal. But we could demonstrate 2 clinical signs here. You can see that he is able to touch the nose with the tip of his tongue. What is this sign called? Suppose somebody is able to touch the nose with the tip of the tongue. What is that sign called? Anybody?
Sign.
That's called the Gorlin sign. And the other one is the Baton sign. Diagnosis, obviously, Ehlers-Danlos syndrome. Okay, diagnosis, Ehlers-Danlos syndrome. This is an adult with Ehlers-Danlos syndrome. It's also known as cutis hyperelastica. This is actually the opposite of cutis laxa. This is cutis hyperelastica. You see children when in the circus are able to do this. I'm sure they should be having some form of Ehlers-Danlos syndrome. Otherwise, it would be impossible, virtually impossible to do something like this. Now, what is this? This is a traditional way of greeting by Indians. This is called namaskar. Okay, the typical Indian greeting when the forearms are folded in front of the chest and the palms are opposite. This is Namaskar. What is the relevance of Namaskar in our discussion today? This is called reverse Namaskar sign. Okay, reverse Namaskar sign. Yeah, reverse Namaskar sign. I'm sure people have written it. Reverse Namaskar sign.
Chat box DM.
Okay, they've written it. Good. So this may be a diagnostic clue to Ehlers-Danlos syndrome. This is actually described by an Indian dermatologist, Professor Premalata from Chennai. It was published in Indian Journal of Dermatology in 2010. The reverse Namaskar sign of Ehlers-Danlos syndrome. This is another classic spot in pediatrics. What's the finding and what's the diagnosis? Lesion is called a nevus flemmis. Diagnosis is Sturge-Weber syndrome. Okay. Now, how is Sturge-Weber syndrome inherited? Actually, Sturge-Weber is one of the neurocutaneous syndromes which is sporadic in inheritance. It is sporadic. A neurocutaneous syndrome which is sporadic is Sturge-Weber syndrome. What's the radiology finding? Can you see the radiology finding? What is it? That is rail dot calcification. Rail dot calcification. What are the neurologic complications of Sturge-Weber syndrome? They tend to develop hemiplegia, stroke, etc. Facies. Eyes are beautiful organs, and a careful examination of the eyes will give you subtle clues which may help in the diagnosis of very serious or sinister underlying diseases. So let's see some ocular signs. Now, what are the causes of puffy eyelids without generalized edema? What are the causes of puffy eyelids without generalized edema? Students, apart from a KMCT, can answer. What are the causes of puffy eyelids apart from without generalized edema? Just puffy eyelids. No generalized edema. Which physiological condition can cause puffy eyelids without generalized edema? Crying. Okay, if you cry for something, there may be puffiness. Similarly, something which we are all expected students are very fond of, that is sleeping. So the two physiological conditions which may cause puffy eyelids without generalized edema are sleeping and crying. What are the other causes? Which VPD may cause puffy eyelids? Measles, especially the severe type of measles, sometimes a whooping cough. Okay, so these are the VPDs or vaccine preventable diseases which may cause puffy eyelids without generalized edema. The another clue is Alice in Wonderland syndrome. So suppose you get a short note on Alice in Wonderland syndrome. What are the two causes of Alice in Wonderland syndrome? One is seen in brilliant students, that is migraine. The second one, what's the second cause of Alice in Wonderland syndrome? The infectious disease. Anybody?
IM, they've written IM, sir. Chat box IM.
Good. That is infectious mononucleosis, Alice in Wonderland syndrome. So that can also cause puffy eyelids. Hypothyroidism, one of the classic presentations of hypothyroidism is with puffy eyelids. Dermatomyositis, trichonellosis, and genetic syndromes like Williams syndrome. All these conditions can cause puffy eyelids without generalized edema. With generalized edema, there are so many conditions, nephritis, nephrotic syndrome, and so on and so on. But puffy eyelids without generalized edema, these are some of the important causes. One of the striking syndromes. What are the diagnosis? Look at the eyes. What's the finding in the eyes of this child? Anybody? Anybody? What is the finding in the iris? Looks like stars. Anybody's written Shiji? Chat box Shiji? Starry iris. These are starry iris. You can see the iris looks like starry.
Chat box.
Yes?
Starry eyelid. Starry iris.
Okay. So that is diagnosis is obviously Williams-Buren syndrome. Williams-Buren syndrome. You can see the periorbital edema. See the periorbital edema. Blue eyes, starry iris. Look at the philtrum, very long philtrum. Prominent lower lip. See, prominent lower lip, small chin. So these are some of the features of Williams-Buren syndrome. The gene is on the long arm of the 7th chromosome. The classic cardiac lesion is supravalvular aortic stenosis. What is the electrolyte disturbance of a Williams syndrome? Williams-Buren syndrome. What is the electrolyte disturbance of Williams-Buren syndrome? Anybody? Electrolyte disturbance is hypercalcemia, and the facies is called elfin facies. Okay, the facies is called the elfin facies, and the electrolyte disturbance is hypercalcemia. Now, this is a 2-year-old girl from Argentina, and this is a 13-year-old girl from Brazil. Now, what is common to this 2-year-old from Argentina and 13-year-old from Brazil? One is that both are from South America. Okay, first one. What is the second finding? What is the second finding which is common to them? Both have got unilateral edema. Can you see that? Both have got unilateral edema of the eyelids. So this is a clue for that. What is this?
Caliber swelling, sir. Chat box. Caliber swelling. Chagas disease.
Caliber swelling. Are you in the caliber swelling?
Kavya Menon. Chagas disease. Kavya Menon.
Kavya Menon is biome student from KMCT. Anyhow, this is actually, she's right. This is reduced bug, and it's not caliber swelling. This is reduced bug, Romanas sign. This is actually Romanas sign, unilateral edema due to reduced bug allergy. Bite or allergy is called Romanas, and the diagnosis is not caliber swelling, it is Chagas disease. So Chagas disease, as you know, is common in South America. These children are from South America. One is from Brazil, the other one is from Argentina. Both are from South America. Now look at this child. The child in the middle is a 10 years. She's 10 years. And she's photographed as a 10-year-old normal child and a 3-year-old normal child. That means that her height is that of a 3-year-old child. This is a very unfortunate child because what's the diagnosis here? Actually, from a near Calicut Medical College, she was on homeopathy. What's the diagnosis here?
Hypothyroidism.
Correct. You can, yeah, that's right. You can see her eyes, puffy eyelids, short stature, umbilical hernia. This is actually a congenital hypothyroidism which was not diagnosed and treated properly for a very long time till she became 10 years. So we made a diagnosis of a hypothyroidism, put her on treatment. You can see the striking difference in 2 years. So just in 2 years she has become like this. One more year, she's very tall and very cute looking now. At 14 years, she's seen with another child. What's her problem? She has got hyperthyroidism. See, you can see the proptosis, the hyperthyroidism. Okay. So the same child at 10 years and 14 years. So she has gained her height and her beauty, but she is still mentally retarded. She is severely retarded. I always believe that really doesn't matter if you miss a rare syndrome of Zellweger syndrome or Hunter syndrome. It really doesn't matter if you miss Zellweger syndrome or Hunter syndrome or syndrome. But as pediatricians, you should never ever miss a diagnosis of congenital hyperthyroidism, because that is the most important preventable cause of mental retardation. If somebody had diagnosed hypothyroidism at birth or at least in infancy, this would not happen. But now, thanks to neonatal screening, this is not happening. Now, what the finding here? Obviously, there is jaundice. There is also bite dot spot. Can you see the bite dot spot here? So jaundice and bite dot spot. So how do you correlate jaundice and bite dot spot? What are the cause of bite dot spots in liver disease? Cholestatic liver. So suppose there is a cholestatic liver disease, naturally all fat soluble vitamins cannot be absorbed, and that's one cause. Second cause is that a decompensated chronic liver disease. The damaged liver is not able to synthesize the transport protein of vitamin, that is retinol binding protein. Retinol binding protein or RBP is synthesized by the liver. So when the liver is extensively damaged, it's not able to synthesize RBP. So hence, transport of vitamin A will be affected. Another thing is that they have got a very poor appetite due to so many reasons. They may not be taking sufficient green leafy vegetables or vitamin A rich food. These are some of the conditions which contribute to bite dot spots in liver disease. Can this ever be a normal finding? Mild subcongenital hemorrhage may be seen following normal delivery. Normal delivery, sometimes you can get a small quantity of a mild subcongenital hemorrhage. But which VPD can cause subcongenital hemorrhage? Which VPD, which vaccine preventable disease can cause subcongenital hemorrhage? Whooping cough, sometimes in hemorrhagic measles. Pertussis. Okay. So many hematological conditions, including leukemia, cytopenia, so many bleeding disorders can cause subcongenital hemorrhage. Now, this I can see this is an old patient of mine, almost 14 years back. She was brought to me for a recurrent lower respiratory tract infection. This is another child, the same disease. very frequent pneumonias. Okay, both are born to consanguineous parents. What's the diagnosis? The examination of the eyes could give you whiter clues. Can you see that? What are these?
Chat box
എഴുതിയിട്ടുണ്ടോ?
chat box ataxia telangiectasia.
That's it. Okay, so you can see telangiectasia. The diagnosis is Lewy bar syndrome, and Lewy bar syndrome is also known as rightly mentioned, ataxia telangiectasia. And these children are prone to develop various types of lymphoreticular malignancies, and both of them unfortunately developed lymphomas and they died. Now, what is this? If you want a clue, I'll give that. This is the clue. What's this animal called?
Raccoon, sir. Chat box.
That is raccoon eyes. So what are the causes of raccoon eyes? Actually, periorbital hemorrhage seen in very serious conditions like a neuroblastoma. It may be manifestation of child abuse or basal skull fracture. So very serious conditions including malignancies, child abuse, and basal skull fracture may cause raccoon eyes, which is actually periorbital hemorrhage. One of my old patients from Calicut Medical College with leukemia. What is this finding called? Anybody? Apart from KMCT, what is this finding called?
Chloroma, sir. Chat box chloroma.
Are Shiji?
Sachin, D. Sachin, Shamadas.
Very good. Very good. This is chloroma. Remember, chloroma is also called myeloblastoma. In which leukemia is the chloroma seen more common? Which leukemia you get more of chloroma? Chloroma is more commonly seen in AML, especially M2 and M3.
M2, sir.
M2 and M3, you get chloroma. So it's usually the classic site is the orbit, and hence it may cause proptosis. Now, why is the chloroma called so? Why is chloroma called so? So, a very common question we may ask in the examination. Why is chloroma called so? Anybody? Because if you dissect the tumor, the cut surface of the tumor has got a greenish tinge. Why? Because of the presence of myeloperoxidase enzyme. And myeloperoxidase enzyme has got a greenish tinge. So, because of the presence of myeloperoxidase enzyme, the cut surface of chloroma is called green tumor. Is called so because of the presence of myeloperoxidase enzyme. Okay. What is this? Again, continuing with the ocular examination. This is a classic ocular finding. What's the diagnosis?
Brushfield spot, chat box.
Right. Yeah, you can see that this child who has written brushfield spot, Shiji?
Sachin, sir. Sachin.
Sachin Tendulkar. Good. Okay.
Sachin.
Okay. Where is he from, Sachin? You can write your college also. Anyhow, this is indeed a child with Down syndrome. He's got brushfield spots.
Ernakulam, sir.
Evidence?
D. Sachin, Ernakulam.
Ernakulam must be your student? Oh.
Yeah. He's a final year student. So yeah, sir. He's a final year student. D. Sachin. Yeah.
It's a you're a final year student. That means you are a great teacher, Shaji. Congratulations.
I was final year student.
Great. That's great. Final year student diagnosing brushfield spots is great. Anyhow, you can see the classic facies of a Down syndrome. You can see the median epicanthal fold and done. Remember that only it's seen in about 40 to 80% of Caucasian children with Down syndrome. But we see so many children with Down syndrome, but it's very difficult to spot brushfield spots because of the color of our iris, because we've got brownish or black iris. That's the reason why we are not able to pick up brushfield spots. It may be seen in other conditions also like Klinefelter syndrome, Zellweger syndrome. Now, what is the differential diagnosis of brushfield spot? Which other condition comes in the differential diagnosis? A very similar spot. That is a question for the postgraduates. Anybody? Condition which is very similar to brushfield spots, but the child does not have Down syndrome or Klinefelter syndrome, Zellweger syndrome. Anybody? The chapter is called Krukman-Wolfin bodies. Krukman-Wolfin bodies. 10% of all children, of normal children, may have these bodies, which are very similar to brushfield spot. There are some subtle differences. These are benign condition, not associated with Down syndrome. It's called Krukman-Wolfin bodies. Very similar to a good ophthalmologist will be able to differentiate these brushfield spots from Krukman-Wolfin bodies. What is this? Somebody said posterior embryotoxin. Are you think this posterior embryotoxin? You want a clue? The clue is this.
Chat box sunflower.
Sunflower cataract. That is sunflower cataract. Which condition causes sunflower cataract?
Wilson, sir.
Wilson
Wilson.
disease.
So many have
Wilson disease. Wilson disease. Good. Okay. So it's also known as Olaf cataract after the ophthalmologist who described sunflower cataract. Olaf cataract. Name the only other condition causing sunflower cataract apart from Wilson disease. One more condition. That is a foreign copper body in the eye. What is a foreign copper body is called? What is it called? Anybody? Chat box.
Mycosis, sir. So many have written.
Chalcosis. They have written chalcosis. Good. Okay. Chalcosis. The copper foreign body in the eye is called chalcosis. Oh, this is a very interesting case. Any takers for that apart from KMC to my own students because they would have seen this. Anybody? What are the findings? You can see that he has got yeah. Chat box.
Tuberous sclerosis.
Tuberous sclerosis is an undergraduate answer or the postgraduate answer. That's very obvious.
Adenoma.
Okay, that's tuberous sclerosis. Sachin, tell your student, Sachin, undergraduate student.
Sachin has written tuberous sclerosis. Our postgraduates have written adenoma sebaceum.
Oh, adenoma sebaceum is actually misnomer. Postgraduate should not say it is an adenoma sebaceum. It's actually an angiofibroma. That's very obvious. Tuberous, I not bother about tuberous. It's very obvious. Sachin, can you look at the eye? Sachin, Sachin, please come. Can you show yourself, Sachin? Where is Sachin?
Sachin, switch on the video, Sachin.
Sachin, can I see you, Sachin? Sachin Tendulkar ആണ് നോക്കട്ടെ.
D Sachin.
Not Tendulkar. Okay. Sachin കാണുന്നില്ലല്ലോ. Can you switch on your video?
You switched it on, sir.
Okay. Anyhow, can you look at the eyes? Sachin, look at the eyes.
Yes, sir.
What's the finding in the eye? Yeah, Sachin Tendulkar. Look at the eyes. Which college are you?
Our medical college.
Yeah, that is CG student. It has to be brilliant because CG is so brilliant. Okay. So Sachin, what's the finding in the eyes? Look at the eyes.
Sir,
Compare the right and left eye.
so color difference is there?
Color, that is, this left eye is paler compared to the right eye. What about there is also partial ptosis. Can you see the partial ptosis?
Yes, sir.
So this partial ptosis, there is heterochromia, and the pupil is constricted. PG is what the diagnosis?
Horner syndrome.
Horner syndrome. Horner syndrome, do you get heterochromia? So the correct answer is congenital Horner syndrome. Okay, congenital Horner syndrome. This is because sympathetic fibers are essential for imparting the normal color to the iris. Okay, so in congenital Horner syndrome, the affected side, the iris will not be pigmented. Okay, so in congenital Horner syndrome also you may get heterochromia the iris, just like bottom. So it's a very rare condition in the patient with the tuberous sclerosis has got congenital Horner syndrome. I think it's very obvious now. Now, how does ocular examination help you to diagnose a cardiovascular condition like a severe AR? Anybody? How does that, just an casual examination of the eyes help you to diagnose severe aortic irritation or patent ductus arteriosus? Anybody?
Chat box, lens dislocation.
Lens severe AR. And what I actually, lens dislocation seen in a Marfan syndrome. Rheumatic, suppose it is rheumatic fever, severe rheumatic AR. Systolic contraction and diastolic dilatation of pupil. Systolic contraction, and what is that sign called?
Dingolfi sign from
Landolfi sign. Landolfi sign. Okay. Systolic contraction and diastolic dilatation of pupil is called Landolfi sign. Then you can use the fundal ophthalmoscope to demonstrate Becker sign, that is prominent retinal artery pulsation. So we have Landolfi sign, which is a systolic contraction and diastolic relaxation of pupils, and then we have a prominent retinal artery pulsation. Now a few words about few slides on jaundice. Jaundice is a yellowish discoloration of skin, conjunctiva, and mucosa when the serum bilirubin is more than 2 to 3 milligrams. I'm sure you will be knowing all this. It's common not only in human beings. Here too, you see a cat and a dog with jaundice due to hepatitis. Common in animals also. Where is jaundice better seen? It's seen in tissues which are rich in elastic fibers and poor in melanin. These are conjunctiva, soft palate, abdomen wall, face, tongue, palms, and soles. But unfortunately, traditionally, we have been teaching you that jaundice is seen in the sclera. Scleral icterus nammal parayada. Is the term scleral icterus correct? I'm afraid scleral icterus is actually a misnomer. Who is this? This is actually a young Sir William Osler. This is a young Sir William Osler. So William also had defined jaundice as yellow tinting of the skin and conjunctiva. He mentioned skin and conjunctiva are not clear. And there are lots of articles in reputed journals, Annals of Internal Medicine, JAMA, Clinical Liver Disease, latest article. All these say conjunctival icterus and is not sclera. This is what the blood sample of the sclera. Remember that the sclerae are avascular, so bile pigment cannot be transported to sclera. So actually, bilirubin or bile pigment is deposited in the bulbar conjunctiva overlying the sclera. So ideally, that should be called conjunctival icterus and not scleral icterus. Besides, now we know that the sclera are actually very poor in elastic fibers. The bulbar conjunctiva contain a lot of elastic fibers, but sclera are actually poor in elastic fibers. So the actual term, the correct term is actually conjunctival icterus, but we continue to treat students as scleral icterus. But most of the gastroenterology textbooks have changed to conjunctival icterus. Now, who is this and what is the relevance to jaundice? Who is this? Anybody? Sachin, who is this? Sachin D from Cochin Ernakulam Medical College. Who is this? Who is this? Who is this beautiful lady?
Soha Ali Khan. Kavya Menon has chatted.
Kavya Menon is my student. Kavya Menon. I used to call her Kavya Madhavan. The actual name is Kavya Menon. Okay. Oh yeah. Anybody else? Anyhow, this is Soha Ali Khan. Okay. And what is the relevance to jaundice? Soha Ali Khan and what is relevant to jaundice? Now I'll give a clue for that. Who is this? Usually students say, sir, this is Soha Ali Khan's father, Mansur Ali Khan Pataudi. This is not Mansur Ali Khan Pataudi. This is Moshe Dayan, the famous Israeli general. And this is her father, Mansur Ali Khan Pataudi. Now, what is common to Moshe Dayan and Nawab Pataudi? Both got only one eye. Both lost one eye. Moshe Dayan lost one eye in a war, whereas Pataudi lost his eyesight in a car accident. So if they develop jaundice, there will be uniocular jaundice. That's the relevance of Soha Ali Khan in jaundice, uniocular jaundice, because artificial eye will not stay with bilirubin because it has no vascular supply. So this, you can see that this is an artificial eye, this is an artificial eye. So if they develop, unfortunately, if they develop jaundice, there will be uniocular jaundice. Can there be unilateral jaundice? Well, you know that if a patient has got hemiplegia, and if he happens to develop hepatitis, he can develop unilateral jaundice. Why? Because the paralyzed side will be less perfused with blood, and hence bilirubin deposition in the paralyzed side will be less compared to the normal side. So you can get unilateral jaundice. So there can be unilateral jaundice. What are the shades of jaundice? What is rubin jaundice? Reddish shade in hepatitis. Classic hepatitis, there is a reddish shade. That is ruba means red. So rubin jaundice means reddish shade in hepatitis. Flavin jaundice. Flava means yellow. So lemon yellow color in hemolytic jaundice. That's called flavin jaundice. So we have rubin jaundice, we have flavin jaundice, and in cholestatic jaundice we have greenish shade. That is called verdin jaundice. Verdin means green. So verdin jaundice means greenish shade in cholestatic jaundice. What are the conditions that come with different diagnosis of jaundice? We have carotenemia, okay? And what is the antioxidant present in tomatoes? If you are fond of eating tomatoes, you get lycopenia. So if you take a lot of tomatoes, you get lycopenia. Or if you take a lot of carrots, you get carotenemia. Both may be mistaken for jaundice. And drugs like quinacridine hydrochloride, nitrous oxide, now we are using nitrous oxide, or excessive exposure to phenol can all cause yellowish discoloration. This is a phase of a patient, actually an adult with decompensated cirrhosis. What is finding? You can see there are a lot of telangiectasia. Can you see the telangiectasia? Can you see the telangiectasia? What is the condition called? These resemble the threads of American dollars, and hence this sign is called the American dollar skin. Yeah, American dollar skin or paper money skin. Is it diagonal, Shiji? No.
Spider neve.
It's actually not spider neve, actually telangiectasia. Okay, American dollar skin. Spider neve is actually different. These are telangiectasia. Now, when you suspect neonatal cholestasis, whenever a child or the mother complains of high colored urine with staining diapers, that can never be physiologic jaundice. Okay, or the stools are persistently pale. Now, what are clay color stools? What is the color of clay? This is a clay in Kerala, but the stools will be very pale. These are the stools. So actually, the clay color they are referring to the Chinese clay, not our clay. The Chinese clay is like this. Okay, our clay, if it is actually our clay, you should be happy because that is a pigmented stool. So what they refer to is the Chinese clay, which is pale. And what is it? This is the normal stool of neonate, and this is the pale or clay colored stool of biliary atresia or cholestatic liver disease. Now we'll have a quiz. We'll have another quiz for you. Are you ready for the quiz? Sachin, where daughter? Sachin, Sachin, can you? Sachin,
Yes, sir.
yeah, Sachin. Actually, a quiz for you. Yeah, let's see how good you really are. So we had a child with anemia, recurrent abdominal pain, and hypertension. A 10-year-old boy with anemia, recurrent abdominal pain, and hypertension. Okay, this is the peripheral. Now I will give you a clue for another clue. So this is the ocular oral finding and the peripheral. This is the clue.
ഞാൻ പോയി
Blood
വാതിലെടുക്കട്ടെ
poisoning.
ഇത്ര ഭാഷയായ
Who is this lady, Sachin? Who is this
അമ്മക്ക് ഒരു
lady?
10
I
മിനിറ്റ്
don't know,
പഠിക്കണം
sir.
Who is
വാശി
this lady?
പിടിച്ചാൽ എങ്ങനെയാ
I don't know, sir.
This is actually Elizabeth Taylor. No, Elizabeth Taylor was one of the famous heroines of.
പപ്പ ഒരു മിനിറ്റ് ഇവനെ കൂട്ടിട്ട് പുറത്ത് പോയ ഞാൻ വാത്ത് തെറ്റിട്ട് തുറന്നു പോയി കുറച്ചു നേരം എടുത്ത് പുറത്ത് പോയപ്പോ
Can somebody mute? Can somebody mute? Okay. So this is actually Elizabeth Taylor. No, you know what was Elizabeth Taylor's favorite hobby? That was getting married. She was married 7 or 8 times, and this was her ex-6th or 7th husband. If you know his name, you can diagnose. What is his name? The very famous actor. He acted as the Mark Antony in the English classic Cleopatra. So his name is Richard Burton. Okay, Sachin.
But
Now what is
it's
this finding?
Bartonian line suggestive of
That's
lead
right.
poisoning with
Correct,
characterized by
you are right.
anemia, encephalopathy,
Correct,
and
absolutely right.
intestinal colic.
Okay, absolutely right. I would like to congratulate not only Sachin but also his teacher, Shiji Jacob, Professor Shiji Jacob. That's an absolutely stunning answer, Sachin. You can see this. This is the lead line. Okay, that's called the Burton's line. And what's the finding in the peripheral smear, Sachin? What's the finding?
Stippling. I don't know.
RBC. You can see basophil stippling of RBC.
Stippling.
Severe,
Basophil stippling.
severe hypochromic microcytic RBC. Can you see the hypochromic, severe hypochromic, and you also see the stippling of RBC. So that is basophil stippling. Diagnosed as in fact, Shiji had already diagnosed it correctly. Plumbism or lead poisoning. Okay, absolutely right. The child's father was a painter. He had severe pica. Okay, that's why he developed plumbism or lead poisoning. Okay, any takers for this? This child too has recurrent abdominal pain. What's the finding in the lips? You can see spotty hyperpigmented spots of the lips. Can you see that? So recurrent abdominal pain, spotty pigmentation of the lips.
You
This is
heard Ahmad, so many people have
so
Ahmad,
many people
Lakshmi,
have- Okay,
Rakesh.
correct. Okay, so this is the endoscopy finding polyps. So this is, as they have rightly mentioned, this is pure Jaeger syndrome. Another classic finding: pigmented lips, pigmented fingertips. What could be the diagnosis? It's very important that we diagnose this condition. It's actually very easy to spot this condition.
And Deepika says Addison, sir.
Yeah. Now, who is this? Anybody? Sachin Dharana?
Ahmad Musa says Addison.
That's right. Okay. Sachin Dharana?
I don't know, sir.
My goodness. Pediatrics മാത്രം പഠിച്ചാൽ പോലെ ജനറൽ നോളജും കൂടെ വേണം കേട്ടോ. Anybody who is this?
Ahmad Musa എന്ന് പറയുന്നു സാറേ chat box.
Okay. Who is this? He's one of the most handsome presidents of America, who was assassinated in 1962. Okay, by Oswald in Dallas. This is John F. Kennedy. Okay, the diagnosed Addisonic pigmentation. You know that John F. Kennedy was a very handsome person. He had blonde hair. His blonde hair was actually due to Addison's disease due to tuberculosis of the adrenal gland. Okay, so he had blonde hair. His blonde hair was actually One theory is that its blonde hair was due to tuberculosis of the adrenal gland resulting in Addison's disease. What's the X-ray finding in Addison's disease? What's the X-ray? Very striking X-ray finding. What is that? Anybody?
Says microcardia. Ahmad Musa, so many have said.
Okay, Kavya Benan and Musa are my students. Anyhow, microcardia, microcardia. They would have seen this. Microcardia. They're absolutely right. This is microcardia. You get hyponatremia, hyperkalemia, and serum cortisol will be very low, and ACTH will be high. So these are the features which suggest Addison's disease. Now, this child presented with stroke. This is not for KMCT students because I have shown them already. A child with stroke. In postgraduate, just by examining the oral cavity, how do you make a diagnosis of stroke? Is it possible? Stroke with this finding. Anybody? Stroke with this finding.
Deepika says Tangier. Deepika, Bhaskar, Shamadas, B. Sachin.
B. Sachin, Ningal Sachin illa?
No, B. Sachin. Lakshmi says.
Okay.
Tangier.
So this is a clue for that. See, this is orange. So this is orange tonsils. Can you see the orange tonsils? And they're absolutely right because this is called Tangier disease. What is Tangier disease? Absence of HDL, high density lipoprotein. HDL, it's N-alpha lipoproteinemia. They develop hypersplenomegaly, cloudy corneas, coronary artery disease, as well as stroke. So what I'm trying to say is that just by examining the child with stroke, you find tonsils like this, which resemble an orange. You can even suspect a rare condition like Tangier disease. Another quiz. What is the relevance of this in rheumatic fever? What is the relevance of this in rheumatic fever? What is this? Is an airport like a print to the Vadamari and that's actually donut. What is a donut? Yes. Donut lesions are seen in the soft palate and hard palate in streptococcal pharyngitis. These are donut lesions of streptococcal pharyngitis, which may result in rheumatic fever. Okay. So streptococcal pharyngitis causing donut lesions. So what is this? Hypertrophy of the gums. So what are the causes of hypertrophy of gums? Several drugs can cause hypertrophy, like phenytoin sodium, various calcium channel blockers, cyclosporin. Which leukemias cause hypertrophy of gums? Remember that only AML M4, that is myelomonocytic leukemia, and AML M5, that is called Naegeli's leukemia, and AML M5 or Schilling's leukemia. These can cause hypertrophy of gums. One is myelomonocytic leukemia M4, the other one is monocytic leukemia, that is M5 or Schilling's leukemia. So similarly, Hunter syndrome, Hurler syndrome, mucolipidosis, and Hand-Schüller-Christian disease, so due to Langerhans cell histiocytosis. So these are some of the conditions which can cause hypertrophy of the gums. And scurvy may cause spongy bleeding gums. Scurvy may also cause spongy bleeding gums. A very easy spot on, what is it? Unimmunized child with Koplik spots. Okay. Remember that the way Koplik spots may be seen not only the oral cavity but even the vaginal mucosa. These are some of the typical sites of Koplik spots. The oral signs of infection apart from Koplik spot. What is the enanthem of rubella? Sachin, what is the enanthem of rubella? Sachin from Ernakulam Medical College. That is called Forsheimer spots. The enanthem of rubella is Forsheimer spots. What is the enanthem of roseola infantum? Anybody? Enanthem of roseola infantum? That is Nakayama spots.
Okay. Nakayama, they mentioned Nakayama, sir.
Okay. Now, what? Sachin, you're Sachin D. Good. Now, what about mumps? Can you diagnose mumps by examining the oral mucosa? There may be a finding like this. Inflammation in the orifice of the Stensen's duct. See, this is the Stensen duct, which is inflamed. So this is called the Tresillian's duct sign. So before the parotitis appears, there may be a positive Tresillian's duct sign. So this may help you to diagnose or suspect mumps.
So you're remembering my parotid gland.
Parotid gland. Stensen duct is the duct of the parotid gland. Now, what is the named ocular sign of measles? Named ocular sign of measles. a transverse line of inflammation in the lower eyelid conjunctiva. That's called Stimson's line or Stimson's line. This is actually, the name is not mentioned in Nelson, it's mentioned in 4-far, and it's mentioned in 4-far only, Stimson's line. So this is actually, which bacteria are notorious to cause caries teeth? Actually Streptococcus mutans. And the recent advance about Streptococcus mutans is that a vaccine against Streptococcus mutans is in the pipeline. So if this vaccine is available, all children with congenital heart disease and nephritis may be given Streptococcus mutans vaccine. What is this? Anybody? This child has got congenital syphilis. So notching of the upper permanent central incisor is called, what is the sign called? Hutchinson's teeth. Notching of the upper permanent central incisor is called Hutchinson's teeth in congenital syphilis. What is this? Short stature, solitary median maxillary central incisor. That's a marker of hypopituitary. So that's a marker of hypopituitary. Now this child, one of my patients with, he's got very striking facies. What are the features? Look at his face. He's got a triangular face. Anybody other than KMCT Medical College, you can spot this correctly? Broad forehead, Elegel syndrome, the broad forehead, pointed chin, triangular face, bulbous tip of nose, deep set eyes. The same child at 10 months and 4 years. Unfortunately, he developed decompensated liver disease and died by 5 years. What the finding in his oral cavity? You can see that his teeth are greenish. This is called chlorodontia, which means that his dentine has been exposed to high levels of bilirubin right from birth. This is called chlorodontia or greenish teeth. There's another child with a dental finding. He's got red teeth or erythrodontia. This is the urine of the same patient. How do you correlate this urine with erythrodontia? Anybody apart from KMCT? Erythrodontia and such urine. This urine is called burgundy wine urine. Where do you get burgundy?
Porphyria.
For which porphyria? Which type of porphyria? PG should say which type of porphyria. That is congenital erythropoietic porphyria. It's seen only in congenital erythropoietic porphyria, and which is also known as Gunther's disease. Okay, so congenital erythropoietic porphyria, Gunther's disease causes erythrodontia. This is macroglossia. It may be due to local causes like hemangioma, rhabdomyoma, but several systemic conditions can cause like cretinism. I'm sure you'll be knowing all this. These are some of the causes of macroglossia. And of course, Beckett-Weber syndrome. Systemic disease which cause macroglossia. What is pseudomacroglossia? Which condition causes pseudomacroglossia? Remember that in Down syndrome, there is actually no true macroglossia. The oropharynx is too small to accommodate a normal sized tongue, and hence there is an apparent macroglossia or pseudomacroglossia in Down syndrome. You see a lot of children with cleft lip and palate, but this is different. And these isolated cleft lip and palate are of sporadic inheritance. But what is wrong with this child? If you look at the lower lip, can anybody spot the diagnosis? Look at the lower lips. Anybody? Any PGs, final year PGs who can spot the diagnosis? Shiji Dijit in the Shiji Dijit, where is your student? Shiji Dijit from Amala. Shiji na kandilla. Shiji indairunilla. Shiji, are you there? Shiji inda. Shiji.
Yeah.
Shiji Dijit. Okay.
Says Vander Wow.
Almost Vanderwoodson. That's right. Vander. Adare idikkunna Shiji jekku.
Arif Khan, Vander Wow.
Arif Khan. Oh, Arif Khan is my old student. He's Captain Arif Khan actually. Captain Arif Khan. He passed as the MD from Calicut Medical College, and now he's in Navy. Captain Arif Khan. Yes. Vanderwood syndrome. So look at this child. These are another two more kids with Vanderwood syndrome. You can see the lipids more clearly. The importance is that why should a pediatrician diagnose this rare condition or think of this rare condition? Because this is an autosomal dominant disease, and hence the risk to the next child is almost 50%. And the parents may be having only lipids. So whenever you get a child with cleft lip or palate, please look for lipids also. Now you can see dilated anti-abdominal wall veins. What are the other findings? You can see a scar here, ascites, umbilical hernia, incision hernia, plus dilated anti-abdominal wall veins. What type of portal hypertension is this? Is it intrahepatic portal hypertension or extrahepatic? is actually intrahepatic portal hypertension. I can't discuss that now due to the lack of time, but remember that you know that Kijaka was destined to be killed by beam. So if Kijaka has been killed, the person responsible is beam. If Kijaka is killed, beam is responsible. Similarly, if there are dilated anterior abdominal veins, the pathology has to be within the liver. It is intrahepatic portal hypertension and not extrahepatic portal hypertension. Spot or the diagnosis. This child is crying, or the diagnosis, is it facial palsy? Anybody?
It's DAO, sir.
Yeah. See, you can see that he's able to close the eyes properly. So this is actually deficiency of depressor angular oris muscle on the left side. Okay, so the overaction on the other. And what is this? Here, this child is trying to close the eyes. She is not able to close the right eye. Right eye. So there is a paralysis of the right side of Bell's palsy. So this is facial palsy, and this is depressor angular oris muscle absence. It's very unfortunate, but we can see such cases only in Calicut Medical College. This is a very unfortunate child. Or the diagnosis, very characteristic expression of that child. Anybody? What's the diagnosis? It's very difficult to see this. Nowadays, we should not.
Christmas.
This is rhizus sardonicus. This is actually rhizus sardonicus of tetanus. This child, this is an unvaccinated child who subsequently died after prolonged treatment in our hospital. Rhizus sardonicus of tetanus. So this is simian crease. Remember that unilateral simian crease may be seen in 4% of normal people, and bilateral simian crease in 1% of normal people. Just because somebody has got simian crease doesn't mean that he has got Down syndrome. These are some of the other causes. Now, who are the celebrities with simian crease? Who is this? This is Hillary Clinton. And who is this? Robert De Niro, the famous Hollywood actor. Both have got simian crease. And who is this? This is Tony Blair, and instantly the former PM of Britain, he has got bilateral simian crease. Now, what's the relevance of John F. Kennedy in chromosome anomalies? What is this sign called? You can see there is a deep vertical crease between the first toe and the second toe. This crease is called, anybody?
Kennedy crease. Ahmad Musa says Kennedy crease.
That's Kennedy crease and Down syndrome, correct. Now, what is this? Anybody? What is this? Clue. This is the clue for that. Spider. So, fingers like legs of spiders, arachnodactyly. This is arachnodactyly. Arachnodactyly demonstrated that there are two signs for arachnodactyly. One is the Steinbeck's thumb sign. The second one is the Walker-Murdoch sign and the wrist sign. Most probable diagnosis is Marfan syndrome. The famous person with Marfan syndrome is Abraham Lincoln, and the notorious person with Marfan syndrome is Osama bin Laden. Both had Marfan syndrome. Shiji, I can always stop. Just let me know when you want to stop. What's the diagnosis? Leukonychia and clubbing. Okay, this is leukonychia. What is this color change, nail change? Anybody? You can see that 80% of the nail, approximately 80% is opaque, and the remaining 20% retains a normal pink color. This is called an 80 and 20 nail or Terry's nail. Whereas here, 50% of the proximal nail is opaque, and the remaining 50% is retained in normal pink color. This is called a 50 and 50 nail or Lindsay's nail. This is seen in chronic kidney disease. Okay, so this is seen in chronic kidney disease. Another one is seen in chronic liver disease. What is this? These are called mucous lines seen in any condition which causes hyperalbuminemia like decompensated cirrhosis, malabsorption, Kwashiorkor, and protein losing enteropathy. These are called mucous lines. This should be easy for the Sachin. What is this?
Koilonychia.
Koilonychia, very good. This is
iron deficiency anemia.
Correct, absolutely right. Good, very good. This is koilonychia in severe iron deficiency anemia. What is this? This is actually Bue's line. You can look up what is Bue's line. And what is this? This is clinodactyly, also known as Seigert's sign, incurving of the little finger due to hyperplasia of the middle phalanx. Okay. This is classically, this may be seen in normal people, but this is classically seen in Down syndrome. Okay. Clinodactyly. What is this? This is a palmar erythema. What are the cause of palmar erythema? What is the physiological cause of palmar erythema? That is pregnancy. Then we have chronic liver disease, chronic fibrosis, rheumatoid arthritis, leukemia. Sachin, and a bike which is not Hero Honda. What is that? A bike which is not Hero Honda, causing palmar erythema. What could be it?
Kawasaki disease.
Correct, Kawasaki disease. It's a Kawasaki disease. What is this? This is Hippocrates. Hippocrates, the first clubbing was actually described by Hippocrates, Hippocratic nails. What are the signs of infective endocarditis, clubbing? I'm sure you'll be knowing all this. I'll rush through some of the slides. What are rose spots? Rose spots is the condition like Anna. Rose spots are seen in endemic fever. And who was Dr. Rose? Was a pediatrician with gastroenterologist. Actually, a doctor, it is not a doctor. It is just rose-colored spots. Okay, it is not Dr. Rose. It is rose-colored spots. This is a splinter hemorrhage seen in infective endocarditis. What is this? Tender transient nodes in the pulp of the fingers and toes in infective endocarditis. This is called Osler's nodes. Okay, and these are Janeway lesions. So we see Osler's nodes and Janeway lesions. This is a neonate with lymphedema. What could be the diagnosis? What could be the underlying diagnosis? A neonate with lymphedema. This could be Turner syndrome. Turner syndrome, or sometimes a Noonan syndrome. At another condition is Milroy's disease. So Turner syndrome, Noonan syndrome, Milroy's disease may present with lymphedema of the feet and birth. What the relevance of this leaf in neurology? What is this leaf? Neurology leaf. Sachin, and the leaf and
Ashleaf, they've mentioned Ashleaf.
Ashleaf macule in tuberous sclerosis.
This Ashleaf macule. This is Tulasi. Tulasi leaf. This is not Ashleaf. You're all fond of what is described as hype. This is not Ashleaf macule. This is Tulasi. Tulasi leaf. Okay. This is an Ashleaf. Okay. So this is a patient with tuberous sclerosis. And if you are patriotic, we should call it as Tulasi leaf macule and not Ashleaf macule, because it resembles more of Tulasi leaf rather than Ashleaf. So this is a child with Ashleaf macule. He had intractable seizures. We could make a diagnosis based on, we investigated, we did a CT based on, because of the presence of Ashleaf or Tulasi leaf macules. Then we'll skip some of the slides. What is this? This is angiofibroma. Okay, angiofibroma, also known as sprinkle spots. It is erroneously called adenomycetation. This we already seen. Let's skip that. A child with tuberous sclerosis at 4 years, 6 years, 14 years. Same, so you can see the changes. What the relevance of this in pediatric neurology? Orange peel, purely orange appearance. That is a shagreen patch has got an orange peel appearance. Okay, purely orange appearance of shagreen patch of tuberous sclerosis. What is this? These are called Cornen's tumors or periungual fibroma in tuberous sclerosis. Remember that Cornen's tumors are usually seen in older children, adolescents with tuberous sclerosis. On which chromosomes are the genes of neurofibrin 1 and 2 located? Neurofibrin, if you count the number of letters in neurofibrin, there are 17 letters. So gene of type 1 neurofibromatous is on the 17th chromosome. And type 2 is on the 22nd chromosome. Okay, there's 17 letters of neurofibromatous gene is on the 17th chromosome. What's the relevance of this? What is this? Coffee with milk, coffee and milk. So you can see that this is a Caucasian patient with a caphylomagus. It appears as if coffee is sprinkled on his skin. So this is known as coffee with milk of giraffes or caphylomagus. This is caphylomagus. What is cause of California appearance? Cause of California appearance is seen in type 1 neurofibromatosis, because the caphylomacules of type 1 neurofibromatosis are very smooth. I've got very smooth regular borders, just like the cause of California. Whereas in what is this? Large caphyllopatches with very irregular borders, and this is like the cause of Maine. Okay, so where do you get cause of Maine appearance? Which condition cause of Maine appearance? With precocious puberty, polyostotic fibrous dysplasia. That is McCune-Albright syndrome. So cause of Maine appearances in McCune. The tip is Maine and M. McCune starts with M and main M. Heard of Merlin? What is Merlin? Merlin is one of the toughest names to remember. It's actually a protein. Myosin, esrin, radixin-like protein. This is the gene product of type 2 neurofibromatosis. It's not somebody's name. It's a protein called myosin, esrin, radixin-like protein. Very difficult to remember. And what is this in neurofibromatosis? Freckling of the axilla is called Crow's sign. Freckling of the axilla is called Crow's sign. Virtually pathognomonic of type 1 neurofibromatosis. Name the neurocutaneous syndromes in which cutaneous lesions are absent or very rare, very sparse. The two neurocutaneous syndromes with very few cutaneous lesions. Number one is type 2 neurofibromatosis. Number one is that. Number two is von Hippel-Lindau syndrome, also known as retinocerebellar hemangioblastomatosis. Retinocerebellar hemangioblastomatosis. For the diagnosis, this is called Leopard syndrome. You can look up what is Leopard syndrome. One of the last coming from the last slide. This is a clue for a neurological disease. What is it? A clue for a neurological disease. This is inverted champagne bottle appearance. Okay, where do you get inverted champagne bottle appearance? That is Charcot-Marie Tooth disease or peroneal muscular atrophy. Inverted champagne bottle appearance. This is what is this sign being demonstrated called?
Gaucher's sign.
Gaucher's sign. That is Gaucher's sign. This is the last slide. Can somebody spot the diagnosis? What is this sign?
Facioscapular.
Is it not facioscapular muscular? This is actually a sign described by an Indian neurologist. We are very fond of signs described by Americans and Europeans. Actually, this sign in Duchenne muscular dystrophy was actually described by an Indian. Okay, this is called the Pradhan sign or the Valley sign. Pradhan sign. A neurologist from SCPJ Lucknow described this Pradhan sign. You can look up what is Pradhan sign. Okay, due to lack of time, I'm not describing it in detail, but Pradhan sign is one of the classic signs of Duchenne muscular dystrophy. Okay, called Valley sign or Pradhan sign. So take a message on all children may have some subtle clinical findings which should not be missed. For example, if you miss coarctation of aorta and cytosine, suppose you palpate the heart and say it is in the left intercostal space, left fifth intercostal space, actually the heart may be, the apex may be on the right side. There's the importance of a clinical examination. That comes in general examination actually. The apex may be on the, so you should never miss coarctation of aorta or cytosine versa because that may be picked up by the examiner. Remember that examiners are usually they're very brilliant people. They will pick up any clinical sign. So should not be picked up by the examiner, should be picked up by the students. And some of the findings could indeed be life-saving. But there's the old dictum, the eye see only what the mind knows. So you should cultivate the habit of examination. Master the clinical art of examination. Thank you so much for listening to me.
Thank you so much, sir, for the enlightening session. Thank you so much. Thank you for being so patient.
Thank you.
Thank you, sir.
Thank you very much, sir, for taking part in IAP Cochin PG Clinic. And on behalf of IAP Cochin branch, I thank you very much, sir. And all the people who have attended. And I will be winding the session now. Okay.